Today I will present about skin graft. A skin graft is a procedure where skin is taken from a healthy part of the body to cover a damaged or lost skin area. There are different types of skin graft. One common type is split thickness skin graft, which use thin layer from the upper skin. This procedure helps in wound healing and protects the affected area. Next, I will explain the etiology, which means the cause of the condition. First, large wounds can be caused by sharp injuries, accidents, or mechanical trauma, such as cuts and falls. Second, burns can happen due to chemicals, electricity, or heat like fire and hot water. Lastly, chronic wounds such as ulcers may be caused by diabetes or prolonged pressure. Next is the verification checklist. First, patient verification is important to confirm the patient's identity and the correct procedure. Second, all equipment and supplies must be prepared and sterile. Third, consent and documentation must be complete before the procedure. Next, pre-procedure preparation includes checking vital signs and preparing the patient properly. Safety measures must also be followed, including ensuring emergency equipment is ready. Finally, after the procedure, proper patient care must be given. Next, I will explain the statistics of the surgery. Skin graft is commonly used to treat burns, trauma, and chronic wounds, such as ulcers. It is one of the most frequently used techniques in surgery. This technique helps to cover wounds and promotes faster healing. It can be applied to large wound areas because only a thin layer of skin is taken. The donor site can heal on its own within a few weeks. The success rate is around 7 to 90%, depending on the patient's condition and proper wound care.
In addition, preoperative assessment includes investigations such as blood tests, imaging studies, ECG, urine tests, and monitoring vital signs to confirm that the patient is fit for surgery and to identify any potential risks early. Thank you. Preoperative care involves thorough assessment and preparation of the patient to ensure safety during surgery. This includes physiological care such as ensuring the patient is fasting, stabilizing vital signs, controlling underlying medical condition, and establishing an intravascular line. Physical preparation focuses on maintaining hygiene through skin preparation, removing jewelry and prostheses, changing into an operating theatre gown, and marking the correct surgical site. Emotional care is equally important and involves reducing patient anxiety, explaining the procedure clearly, and obtaining informed consent.
I will explain the preparation for operation of split thickness skin graft or STSG. Preparation for operation is very important to ensure patient safety and prevent infection. First of all, the operating room must be prepared. This includes ensuring the room is clean, all equipment is available to use, and the sterile field is set up properly. The surgical team must perform proper hand hygiene and wear sterile gown and gloves. Other than that, patient preparation is carried out. The patient identity is confirmed, consent is checked, and the surgical site is verified and marked. The patient is then positioned correctly and comfortable on the operating table. So, skin preparation is also done by cleaning the donor and recipient site using antiseptic solution to reduce the risk of infection. Sterile draping is applied to maintain aseptic technique. Anesthesia preparation is done by the anesthetist to ensure the patient is pain-free and stable throughout the procedure. Proper preparation for operation is essential to ensure a safe, effective, and successful split thickness skin graft procedure. Split thickness skin graft or STSG is a procedure where a thin layer of the skin is taken from a donor side and placed onto a wound to help healing. In this procedure, preparation of instrument is very important to ensure the surgery is safe and effective. The instruments are divided into several groups. First of all, harvesting instruments such as hematome, blades, and mineral oil are used to take the skin graft. Next, graft preparation instruments like skin measures, scissors, and forceps are used to prepare and handle the graft carefully. Then, recipient side instruments such as scalpel, curette, and artery forceps are used to clean the wound and control bleeding. Fixation instruments like a suture or stapler are used to secure the graft, while general instruments such as suction, gauze, and drip help maintain a sterile film. So, overall, proper preparation ensures sterility, correct function of instrument, and smooth medical procedure.
Now, I will explain the implementation phase of the procedure. First is positioning. The patient is placed in supine position, which means lying flat on the back. This allows the surgeon easy access to both the donor and recipient sides. Next is draping. Both the donor and recipient areas are cleaned using an antiseptic solution such as povidone iodine to reduce the risk of infection. After that, sterile drapes are applied to maintain a sterile field. Then we have sign in, time out, and sign out. This is a safety step where the surgical team confirms the patient's identity, the procedure, and the surgical site before starting. Lastly, surgical count is done. All instruments, sharps, and sponges are counted before and after the procedure to make sure nothing is left inside the patient. Next is the use of special instruments. A common instrument used is the Zimmer dermatomy, which is used to harvest a split thickness skin graft from the donor site. During the procedure, there are also important intraoperative considerations, such as maintaining sterility, controlling bleeding, and ensuring proper handling of the graft. Another important step is the special technique called meshing. Meshing creates small openings in the graft, allowing it to expand and cover a larger wound area. It also helps with fluid drainage and improves graft adherence. Next are the specific responsibilities of the surgical team. The surgeon prepares the wound and performs the grafting. The assistant helps by handling instruments and supporting the procedure. The nurse ensures sterility, prepares equipment, and monitors the patient through the surgery. Finally, the procedure is linked with anatomy and physiology. Split thickness skin grafts include the epidermis and part of the dermis. The epidermis contains important cells like melanocytes and nerve endings. For the graft to survive, it depends on the blood supply from the wound bed to receive nutrients and oxygen. Last but not least, we focus on aseptic technique and surgical wound dressing. Aseptic technique helps prevent infection by ensuring proper wound preparation, maintaining a sterile field, and following correct dressing protocols. For wound dressing, we use products like antimicrobial gauze, film dressings to block germs, and silicone dressings to reduce pain. Overall, proper technique and the right materials support faster healing and prevent complications. Thank you.
I'm gonna explain my point for post-operative care regarding support and pain management. In split thickness skin graft procedures, patients experience pain at both the graft site and the donor site. However, the donor site is often more painful because the superficial layer of skin is removed, which exposes nerve endings. Because of this, effective pain management is very important, not only to improve patient comfort, but also to promote better rest, reduce stress, and support faster healing and recovery. When pain is well controlled, patients are more able to cooperate with care and avoid complications. At the same time, patients may also experience emotional and psychological challenges after the procedure. They may feel anxious or worried, especially about the appearance of their wound, the healing process, or how long recovery will take. Some patients may also have concerns related to body image, which can affect their confidence. As healthcare provider, it is important to offer reassurance, listen carefully to patient outcomes, and encourage open communication. Involving family members can also provide emotional comfort and create a supportive environment for recovery. In conclusion, effective pain management together with strong emotional support play a vital role in ensuring a smooth recovery and improving overall patient outcomes after a skin graft procedure.